Hi everyone, this is Dr. Devin Barley with Greenwich Chiropractic, and today we are talking a lot about mid-back pain. Now, we hear this very commonly, especially people who sit at a desk all day for work, but it also translates to people with active and very physical jobs. Maybe you're a welder or a carpenter or an auto mechanic, or even those weekend warriors who are doing things like golfing, so a lot of rotation. And we'll see a lot of mid-back pain in the office here. And what we have to remember is the mid-back generally is between T5 and let's say T12. So it's that middle part of your back, right in the center, in the middle of your shoulder blades and a little bit down. And what we know about the mid-back is that it's involved in supporting the cervical and lumbar, so the neck and the lower area of your spine, to help create some stability. It's also responsible for a lot of mid-back rotation. So anything for rotating will be worked through in the mid-back. And what we know also about the spine is that you're gonna have a C-shaped curve in the neck. It's gonna curve the opposite way in the mid-back, and then you're gonna get a lumbar curve the same way as the neck. And the reason that those curves occur is basically to provide a cushion or a spring or a shock absorber, so that when you're going throughout your day-to-day, you have a nice cushion for all those discs, nerves, muscles, tendons, ligaments, all of those things. I think when we're talking about the mid-back, what we want to remember is that it is an area that people commonly have pain in, and most of the time what's going to be recommended is something like PT, which is great, anti-inflammatories or medication. There really isn't a lot that can be done that's outside of a chiropractic office. However, you're in luck because chiropractors do an amazing job with mid-back pain. We're able to release those vertebrae, stimulate and unpinch the nerves, get the muscles functioning appropriately, and also break up adhesions or scar tissues that may be forming that are contributing to some of the pain. So oftentimes, especially with mid-back pain, it's really important that you try something like chiropractic first, because it's usually a really good fit. Now, the other thing is that mid-back injury, because that area is relatively stable, it gets stiff, but at the same time, it's stable. So we see results very quickly with things like mid-back pain. And oftentimes, because of the way that the mid-back is built, we see a lot less disc herniations in the mid-back as a result. We'll see way more in the neck and the low back, because those are really doing stressful motions that will get you through your day-to-day. So in this video series, we're going to talk a lot more about mid-back pain, some things that you can do to get on top of it, and how we're going to help here in the office. Thanks so much for listening. We'll see you on the next video.